Dr. Eva Rani Kalita, come in, please.
Good morning, everyone. So myself, Dr. Eva, I'm going to present the study of referral pattern in Pediatric Ophthalmology Department in a tertiary eye care center of Southern India, the REPO study. Blindness remains a major health and social issue in India. Childhood blindness has larger social impact when Delhi is taken into account. Access to the tertiary eye care becomes way more difficult when pandemic situation like COVID-19 hits the world. It's of utmost importance to make every clinician who is the first reach to this population aware of the red flag signs a child might present to them seeking primary care. It's also important to make them identify the embryogenic risk factors and urgently refer to the concerned subspecialty department. So keeping these things in mind, we had the purpose to evaluate the referral pattern to Pediatric Ophthalmology Department in a tertiary eye care center of Southern India in terms of visual acuity assessment, disparity in diagnosis, and delay in reporting. The visual acuity assessment was considered inconsistent if more than or equal to 2-line difference was found when measured in the tertiary center. Disparity in diagnosis was when the final diagnosis didn't correlate to the diagnosis of referral, and delay in reporting was counted when more than 14 days lag was noted from the date of referral by the primary clinician. So it was a retrospective study done for 6 months duration in 2019 in a pediatric age group of 0 to 16 years in the Pediatric Ophthalmology Department of Arvind Eye Hospital, Pondicherry. So we had 77 referrals in this time period. 6 patients were excluded from the study because the records were incomplete. We divided the study group into various age groups like infant, preschool, school-going, older children, and adolescent. So out of the 71 referrals, we found that most of the referrals were by the ophthalmologist, followed by pediatrician, and among others were the cardiologist, pediatrician, general practitioners, and neurologist. The visual acuity assessments showed that only 16 out of 54 children referred by the ophthalmologist had visual acuity mentioned, and they had 75% accuracy of the visual acuity. Diagnosis discrepancy showed that 38% of total patients referred had diagnosis discrepancy, and interestingly, 27% discrepancy was noted in the ophthalmologist referral alone. Delay in reporting was counted for the patients who had some kind of medical or surgical emergency, or the patients who had embryogenic risk factors like squint, congenital cataract, ROP, and isometropia. And we found that 17 patients out of 51 referred were having delay in reporting. So from this study, we concluded that most referrals in pediatric ophthalmology were apt with appropriate visual acuity, but 1/3 of referral had inaccurate diagnosis, and almost half referral in the embryogenic group requiring immediate evaluation were found to be delayed. So proper counseling to the parents by primary eye care providers, emphasizing the need of immediate evaluation and intervention is of utmost importance. There is also need of creating awareness and guidelines for appropriate referral to subspecialty clinic in ophthalmology. Thank you.
Yeah. Which were the cases which were mostly diagnosed wrongly by ophthalmologist?
Thank you for the question. Most of the patients who had pseudoconvergent squint, they were referred for infantile ETs.
Okay.
Yeah, ma'am. And patient with squint, they were referred for squint, but they were having some cataract, like developmental congenital cataract, and they developed strabismic sensory deprivation amblyopia or squint. And interestingly, the pediatrician used to refer for senile DO, but 2 or 4 patients were having membranous conjunctivitis or pseudomembranous conjunctivitis.
Okay.
Like that, ma'am.
Yeah. Interesting study.
Interesting study. We're just wondering, it's just 38%. Yeah. That's what we were discussing. Yeah, it's just 38%. So because you're all youngsters now, how do you plan to increase it?
Yeah, ma'am, we have already started.
You need to increase it.
We have already started. Like Arvind Pondicherry is located in an area which is surrounded by most of the medical institutions, ma'am, like private medical institutions and some subspecialty hospitals. So we are creating awareness by calling them for workshops or CMEs, or distributing pamphlets mentioning at least these are the child's condition that you have to see, or the red flag signs. At least they can do a direct ophthalmoscope Bruckner test to identify the leukocoria, white reflex. They can see at least to identify some of the major morbidities in children.
I think you should go to them and do the workshops. Nobody comes for the CME sometimes. Even the pediatricians don't turn up. Yeah. You should go there and at least tell them to tell them it's legally bound. Yeah. That it is important to detect, because when they send and we say it's a cataract, Then they say, oh God, the pediatrician ne dekha kyun nahi? Then they ring up the
Interesting,
pediatricians.
from the pediatrician referrals were more in a formal way. They mentioned more details about the children, like these are the conditions we want to know.
That's okay as long as they refer.
Yeah, that's ma'am. And actually, we saw that most of the population, they have the lack of information that we also have the subspecialty departments in ophthalmology right now. Because the pediatrician itself didn't know that we have a pediatric ophthalmology department in ophthalmology.
Okay.
So that awareness we have to create, I think, ma'am.
That is interesting.
Yeah, that's what. Thank you so much.
Thank you.